Have you ever seen a beautiful smile makeover on Instagram and thought to yourself, maybe I should get that treatment done? Or maybe a friend suggested you a treatment, or even your dentist, but at some point you're hesitant because you don't know, is it really benefiting you or is it actually damaging? Today I want to talk about dental procedures that I won't recommend to my patients and I don't want them on my teeth. I'm gonna start with the least damaging to the worst, so make sure you watch this video till the end. Hi, I'm Dr. Anya and welcome to my channel. So let's get started. The first one and the least damaging one is a scaling if you don't need it. So a scaling is when we use a machine which is similar to an electric toothbrush but has a sharp tip to remove the tartar, which is the hard substance that's covering the teeth. So if you are doing a very good practice with your oral hygiene, if you brush twice a day with electric toothbrush, if you floss, usually you don't develop that much tartar. So not all patients need a scaling even once a year. If you don't have tartar, a scaling doesn't actually giving you any benefit. Obviously it doesn't cause any harm, but maybe it's just an unnecessary treatment. Of course, if you have already been diagnosed with gum disease, maybe you need that treatment done every 3 months or every 6 months. But as an average person, you won't need it all the time. And if you ask me how to have less tartar buildup during our appointments, I would say just brush twice a day with electric toothbrush, floss, and sometimes use this sugar-free chewing gum, because sugar-free chewing gum actually helps us to produce more saliva, which wash away our mouth, and actually it has xylitol, which has antibacterial effect. Second is too much Botox for treatment of gummy smile. So if you have gummy smile, you don't have to correct it, obviously, because it's a choice. But not all gummy smile can be treated only with Botox, because if you inject too much Botox, you can have weird smile like this. So if you have severe discrepancy between your jaw size, the upper and lower jaw, or if you have severe gummy smile, maybe at worst case scenario you need the jaw surgery and you need to be checked by your orthodontist. Treating severe gummy smile only with Botox is not gonna resolve well. So this one is a little more invasive than scaling, and I think it's not very damaging because at some point the result of the Botox is reversible. So even if you don't like the result, it can be reversed in some months. The next one is correcting misalignment only with veneers. So I think if you have jaw discrepancies, if you have misalignment, if your teeth are not aligned, you need to have orthodontic treatment or clear aligners. Fixing that only with composite bonding actually results to have a very bulky teeth that patient usually can't clean in between, and it's gonna result in losing the tooth altogether. Some patients are not actually patient enough to get the aligner or orthodontic treatment done, but always think about losing the tooth altogether. I think having a straight and healthy teeth is really worth the time and effort. The next one is oral piercing. So I have seen it on patients, and usually, especially when it is in frenulum, patients usually avoid the area and they can't brush very well, and it actually causes cavities. So I don't think a piercing on a cavitated tooth is actually beautiful. So I think it's better to have piercing anywhere else except the mouth. The next one is gum lift for minor aesthetic reason. So some people naturally have teeth that are covered with gum. In some cases, we need to actually cut the gum a little so the coronal part of the tooth, the crown of the tooth, actually shows. But what is really worth considering is as we age, we lose a little of gum around our teeth. So if we cut our gums when we are young too much, then when we are older, we actually regret it because we need that gum back. Without that gum, our teeth are actually gonna look too long and a black triangle is gonna be visible in between our teeth like this. And the worst treatment award goes to having multiple aesthetic crowns, which means that we actually don't like the shape of our teeth or the color of our teeth, and because of that, instead of whitening, instead of veneer or like ceramic veneer or composite bonding, we choose to have a crown, which is totally unnecessary. 20% of the teeth that have been crowned, usually they die and they need root canal after. We need to consider that everything we do in our mouth, whether it is veneer, filling, whatever we do, has a lifespan, and if we are doing a lot of crowns, basically they're gonna fail in some years, and then imagine we need to replace them. In worst case scenario, we might lose our teeth. Let me know which treatment you are hesitant about. Do you feel confident? Do you feel comfortable about whitening? Do you feel comfortable about having veneer done? Drop me a comment and we can speak. Thank you for watching.